Let me give you today's proverb. It's from Ivory Coast. It's the final proverb from Ivory Coast. Next week, hopefully when CT is back, he will give us a series of proverbs from another country. Today's proverb: in the village that you don't know, the chickens have teeth. In the village that you don't know, the chickens have teeth. We have a doctor in the studio. He'll tell us whether there's a possibility of the chicken having teeth anywhere in the world. Dr. Simon Kigondu is the president of the Kenya Medical Association. Dr. Good morning.
Good morning.
Good to have you on the show again.
Always a pleasure.
Always a pleasure to have you and to have the conversations with you. Congratulations first. The last time we spoke, you were Secretary General of the Kenya Medical Association.
Yes.
Since then, now we understand why you have not even been calling us. You're a busy man.
A busy man.
I mean,
at least a phone call every now and then we would see that, there was some comment but
it's presidential now.
He's the one with teeth.
Access is also limited. And restricted.
I've my nature has been curtailed, actually. They told me now that you're president, you got to limit, some of the things that you used to do as a normal Kenyan.
Right.
And it's interesting, actually, as you go up the ladder, so to speak, then the number of restrictions you get, it's almost like when you speak, you're speaking not for yourself, but people may interpret it to mean that you're speaking for a larger organization. So some of the rules and regulations apply.
You're no longer just Dr. Simon Kigondu.
Yes.
You're now the institution of the president of KMA.
Yes.
Everything that you do. It's good that you're here because as president of the Kenya Medical Association, you'd like to have this conversation. All right. We saw what happened the other day at the Kenyatta National Hospital, particularly the case of a child who was playing next to his elder brother, and unfortunately, the elder brother hit him with a fork.
Yeah.
Fork jembe. It was lodged on his skull. Transferred from Dula village in Thika to Thika level 5, from Thika level 5 to Kenyatta National Hospital. And there, when he was undergoing treatment, he unfortunately passed away. Now, of course, there's a lot of public outcry on this matter. First of all, how long the conversation, how long the mother and the boy were kept waiting at the emergency center before they were attended to. The mother herself, according to a story that was in the Nation yesterday, she said, my son died because I am poor. And her allegation is, I was kept there waiting, I was told to pay, I was told to look for more money, and people were just walking up and down instead of attending to my child as an emergency case. They just ignored my child and went on with their own business. That's a conversation on social media. Of course, the Kenyatta National Hospital explained the first steps that they were doing on the first day. They said, look, this baby is bleeding profusely. We've got to stop the bleeding. This baby then needs to go into theater. We've got to go through the procedure of getting into theater. Later, K&H chairman released a statement explaining what they had done. But it's still out there in the public. How long should somebody with a fork in their skull wait before they go into theater? Yeah. What is emergency if that is not one? Daktari?
Thank you very much, Lati, for those. And I'm very happy that the station takes up what are called matters of public interest. And that's why, after a long time, you've at least have received an invite to the station. And maybe just to start from your proverb. What was your proverb?
In the village that you don't know, the chickens have teeth.
Yes. So that is very good context in terms of the village that you don't know. A lot of the issues we discuss on media are based on the village that we don't know. So the people who discuss, in quotes, the most would be probably a person who is not in that village. So you have given recommendations for a village which you may not be in. You may be hearing about it. And this brings into context that village called medicine. The village of medicine is actually a village in which we live in, and one of the principles of the village is self-regulation.
Okay.
Self-regulation is an important aspect of any sort of profession, and especially in medicine, because it is easier for me, as for instance a gynecologist, to say that gynecologist A and B did A, B, C, D. Maybe this should have been better. Maybe they did better than we should. This the way. So if you have a second party commenting, and for instance, especially if someone is how do you put it? No, a victim, not a victim, like you have lost someone. So you will be commenting from a point of view of the person with a loss.
Yeah.
Doesn't mean you are wrong. You see, so it is your point of view. So in this issue, we always say that all aspects are right. And going fast forward to that and then coming backwards to that, then it is important for us to actually have an audit of this particular and others, because this is not the only child who would probably raise an issue. But it is dramatic because you're seeing a young child with a fork, and you're having social media generating these over and over again.
Yeah.
You see, so it is not the only child, and it is very indicative of a bigger thing. And therefore, as a country, we need to contextualize that particular issue. That issue actually brings out a lot of issues, both as a society and as a health system.
Okay.
So not to particularly, I will come and give a few comments.
Let's begin with this one so that we can contextualize
Yes.
everything based on what is present.
Yeah.
What's current in this particular case.
So let's
take
start
us
with
through
this
the village.
young man. Let's start with the village, and the young boy was playing with it's reported, we are not too sure, with the brother. So in terms of the context, we would have wanted this djembe not to enter the boy's head.
Yeah.
You get?
Yeah.
And that is the concept of what is called primary prevention. So what in this society and caused the boy to be playing with and the boy to hit, we don't know. It would be good to have what is called a verbal audit to find out what led to this reaction. But that would point again to parental guidance, raising boys, specifically testosterone and all. And it would point to safety in the home area and safety elsewhere, safety in the house, you see. So that means that if all these things were in place, then we would not eventually have needed the healthcare that was necessary. Now an emergency occurs whereby the boy gets a djembe in the head, and what is that? So you want to see what is the system that is in place to take the boy from their home area, or call it an emergency. You say, Jembera, what is in place to take this boy from where they have gotten injured, to
where they should
get care. Yeah. So then you start addressing the referral system. I think that we have talked about a lot. Do we have a call? So Latif, if you fall here, what number do you call for an emergency to come? So I can safely tell you that, for instance, if you get a heart attack, you should be able to already know what to do as they're activating the emergency system, and you should be able to get you in hospital in, let's say, 10 minutes. You see, that in place?
As who? The accompanying caregiver, or as a medical practitioner?
No.
Who should know?
No.
As first responder.
No. I'm saying the first responder already, for instance,
should know what to do.
Okay. So in the bigger context, we need to address, does do know what to do if someone falls here and needs resuscitation? And then you ask yourself, if she doesn't know, then what should we put in place? And this, you see, we are thinking in the long term. And of course, there's all those trainings of first aid in school, basic life support. So the mother may not know what to do with that child. So the referral system, are there, you in the context, and just quickly to go back to the...
You're losing us, Dr.
No.
Completely.
How am I losing you?
Because you're going into the future, you're going into the
No,
overall, you're going to the theory.
Okay. Was there an ambulance available to take this boy to?
We start from that point.
Was there an ambulance? There was none. Was there a road access? Was there a road access of this boy to get quickly to the hospital?
In a case such as this one,
yes.
What is it that we know happened? So the boy, neighbors respond to cry of help. Neighbors take the child to a nearby clinic. The medic there looks and sees this is a case that requires
level 4.
Level 4.
Yeah.
Clinician plus neighbors transport the boy to Thika.
Yeah. So we are saying that already is a failed system, meaning that there should have been a call-up system. The mother should have been able to say, my boy has an end. Then there should be an ambulance that has come. There should be paramedics who are trained to resuscitate that boy.
At that point.
Okay. As it's called actually stabilizing, which goes back to the system. Why is this patient not being taken to theater quickly?
Okay.
There's a concept of stabilizing. You can actually kill a patient by taking them to theater without doing the basics. So it's taken. So the referral system, which we have always said should be in place and all. Then you go to the first point of call that the client, were they capable of both doing that resuscitation and the medic, the doctor actually took. He says this one is an emergency, so it's like yeye anajitolea kupeleka. You get what I mean? Why? He has knowledge that this one needs to get to the first.
Case.
Yeah, but what system should have been placed? There should have been medics and paramedics. They're taken, which is good. It's kudos to the health worker for doing that. When they are taken to the next point of care, which is Thika level 5. So we say, but the stature of Thika level 5 is such that they should actually be able to handle that, because it is one of the 10 referral facilities in the country. And as we go up the referral ladder, and what is it? Thika level 5 should be having like 4 neurosurgeons, let's say, assuming this is a case that requires neurosurgeon. And that now goes back to the stature of human resources for health. Do we have enough? And how is that system run?
In the hierarchy of our hospitals, we got level 6 is the topmost.
Yes.
Level 5 is the second.
Yes.
And the level 5 is equivalent to the former provincial general hospitals, right?
Yeah.
And Thika is a level 5 facility.
Yeah.
So what you're saying is Thika level 5 should have been able to deal with this particular case there.
Yeah.
If everything has happened, the boy has arrived, he's been brought by a medic, it's an emergency, they should be able to address the issue there.
Yeah.
And
now this boy, when they reach Thika level 5, they were referred. So you need to do an audit and find out what are the factors that led to a referral of this boy as opposed to the boy being treated there. And there are many things. Having worked in a public health system, we can tell you, maybe there was an emergency cesarean section in theater, whereby, and there are 10 other linings, and therefore there is no space.
There's no available theater space.
There's no available theater space. Maybe there was no neurosurgeon. Then you now go into the human resources for health kind of corporate. Maybe there was no what? You get what I mean? So you address that and look for it. Now, then the patient is taken to Kenyatta National Hospital. So he's done that, and there is a report by KNH. We did ABCD. And so you need to assess and say, eventually, what was the reason? And they gave reasons in terms of there was clotting, the brain tissue by the time is there is infection, so you need to stabilize. And medically, and hence your proverb, medically I would say yes. For instance, you can have someone who is really sick, but the anesthetist comes and says the renal function is not good. And therefore we cannot go to theater now until you improve the renal function. Just to give you a quick outline of the medicines given to someone to sleep need to be urinated out for that person to wake up. You get what I mean? So if your kidney has failed and we give you that medicine, essentially we have killed you.
It's gonna be difficult to wake up.
So to stabilize, and there is all this protocol in terms of what is it called? Theater prep.
Right.
You get what I mean? Preparation of theater and all. So we need to establish, was this what was being done at that particular time? Yeah? And to go that. So for you to get a judgment call on this particular card, you need a very good sort of audit report for you to address all the issues backwards.
Doctor, if I may just jump in. I can understand what you say for us to be able to make a judgment call, because I mean, as callous as it may sound, unfortunately, this life is lost. There's really nothing we can do about it right now. This particular child, right? But there is a lot that can be done for future cases to be able to save a situation. So I think the question that we're asking is, what ought the procedure to be if somebody presents themselves to the accident and emergency units in a national referral hospital, number one, and it is an emergency of this nature? What should the protocol be from step 1 to 2 to 3? Should we be dancing around asking, have you paid the 20,000 shillings? Should we say the first thing, deal with this? It's like you said, are we going to assess a situation? Can we remove? Do we go to surgery immediately? Would this woman be dishonest by saying that she sat in the A&E from Monday night until from Monday evening until early Tuesday morning? So then the question arises, what then was going on?
What was happening?
And what should be happening in a situation like this? We're talking about future cases here.
Correct.
Yeah.
Correct. And now let me now also fast track you to how do you normally do this? There is something in state called the state coroner. Yeah. And in 2017, the Coroner Service Act, number 18 of 2017 was enacted. But not operationalized fully yet. So that's 2017, which is a lot of the issues that were brought by the Health Service Act. What is the purpose of a state coroner? The purpose of a state coroner is to publish and learn from death. You get? So in essence, the state coroner would actually come in this case, and go through the whole scenario, exactly from where we are saying, from the journey of death, literally. Because the journey of death, for instance, for we as obstetrician gynecologists, is a journey that you start from school. You know the journey of death. The issue of, and this also applies to they're called the 3 delays. You see, the delay at home, the delay in between the journey, and the delay in the institution. Right.
So you see, a lot of these we are focusing on. We are saying, is there the third?
We are going
delay.
at the delay.
You get what I mean? Which we are trying to dissect as in that. So if it's established that there are these delays, then the state coroner actually gives recommendations which must be implemented. Now, medics have always given recommendations, but the medics, unfortunately, are blamed for factors they do not control. For instance, if you are a medic, then you diagnose that this patient needs drug X in a public hospital, and the drug is not available. Then the client will come and say, "Ooh, daktari, tupe dawa." You get what I mean? Where there is a disconnect between who should. Ideally, the government, let's put it that way, let's use government as an excuse, so to speak, should have bought the drug. The medic was there, diagnosed, and the drug was not available. So people will generally say, and now to also bring back to this, and you'll see a lot of what is called medic bashing. And let's go back to now one of the pillars of a health system, which is healthcare financing. One of the complaints the mother had was that she was being told to pay at each stage. You see, and this model of healthcare financing is called out of pocket, which in the universal health coverage strategy is what we want to eliminate. Ideally, a person who is sick should appear in a health institution, get treated, and the health, the institution, the monies get paid somehow. You get what I mean? But they should not serve as an obstruction to care.
To receiving care.
Now, several institutions, KNH will say that we do not have adequate budget to cover all these things. So one of their ways of sustainability is charging the patient. So you'll find several people getting charged for whatever. They have defined what needs to be charged, who's to pay what. So healthcare financing is one of actually the barriers to access, because you can hear from her statement that I was being told to pay 200. But now, look at it this way. It is not the doctor charging.
It's
not the doctor, but for the mother.
In the case of an emergency, Doc.
Yes.
In the case of an emergency such as this one,
yeah,
where does financing and obstruction to accessing care in an emergency, how do they interplay? Because I see what you're saying. Yeah. You're saying that this particular case is one that then should make us have a conversation about how our healthcare system is organized and how it works, how it ought to and how it works. Now, I think it would be best if you use this to pick out examples and say, at Thika level 5, this child should have been treated and taken back home.
Yeah.
Now, what we know is that Thika level 5 did not do it because it lacked this, and the other. And this should have come from these quarters. Now, we are not talking about that. We are sort of now going back into what we usually discuss on a daily basis, which is what should happen.
Yes.
And we are not putting it into the context of, because that did not happen, you see? Because this is it's a perfect opportunity, to put it bluntly, for medics to say, this is exactly what we talk about.
Yeah.
If the case here is that the medics were not negligent, if the case here is that the institution and management does not have a policy for negligence, if the case here is that if an emergency case such as this one arrives, we have an X turnaround time policy to address such an emergency, but then we are hampered by these other factors. Yeah. Those are the things that we should be hearing.
Yes.
We are not hearing that. We are not hearing that from the Kenya Medical Association. We are not hearing that from the Kenyatta National Hospital.
We are
not hearing that from the Kiambu County government.
You don't want to hear, but they have actually said. You see, when Kenyatta National Hospital produces a statement that you refuse to look and actually say, yes, we agree, ABCD, we don't agree, then you cannot say they are not hearing. But let me just give you, and
they could have said it.
They actually said
we just
it.
Haven't
they actually said it now. And one of the things, I like what you have asked, and one of the things, because obviously as the president, I actually asked about this particular case in Kenya.
Sure you're
and they told me, it's good you also educate, and they told me, they actually said me, there is a service charter. There is a service charter for in various public hospitals. And if you Google and get the service charter for KNH, they actually give what should be done in case of an elective, what should be done in case of an emergency, and you can put them to task based on whatever case, not necessarily this particular case, on their service charter. They say if you come here, registration is 5 minutes. Was it 5 minutes? And if it wasn't, what was it? So one of the issues is that hospitals previously actually display their service charter on them. Now, in terms of health systems, we have always, let me now start with the usual story of a health service commission. And even before that, unconstitutional devolution of health. What we had said was that county governments are supposed to be in charge of primary public care. And the national level, we are supposed to be in charge of that curative care, hence the levels of hospitals. That makes it for more efficiency, meaning that if you, for instance, have a health service commission, then you would be training and deploying neurosurgeons to Thika, to Isiolo. And this is a question I posed to the current president before he became the president, and hence our health service commission was put in the manifesto that a governor, it is not in the interest of a governor to train a neurosurgeon. Why? Because his training outlives the governor's time span. So I can't spend money where I will not look like I have gained. But if you have it at a national level and say, yes, we figure that we are seeing more injuries of requiring neurosurgeon, then a nationalized system would actually do that and post.
Let's take a break, Doctor. Let's take a break so we can then again restructure the conversation. 27 to 9, this is a Situation Room. Dr. Simon Kigondu is the president of the Kenya Medical Association. He's here with us because you're raising the question, the deadly cost of hospital wait times. Could the case at KNH this week have been prevented and avoided? What is it that, of course, patients will die in cases, but doctors will work very hard to avoid a death. So it will be in the inevitable point of death. What preceded it, and how could you have been avoided? That's what we're discussing this morning with Dr. Simon Kigondu, also highlighting, so what are the gaps, what needs to be filled in the gaps that are in our healthcare system.
This is the Situation Room, the only way to start your day.
Conversation continues with Dr. Simon Kigondu, the president of the Kenya Medical Association, on what we need to see in hospital. We're taking the case of this boy who died recently at the KNH. It happened that he was playing. It was reported that he was playing with his brother at home. The brother, unfortunately, struck him with a fork. Fork got stuck in his head. Neighbors responded to the cries, and they took the child to a nearby clinic. The medic at the clinic looked at the case and determined it to be an emergency case which he could not handle there, needed a proper facility. So medic plus neighbor plus mother took the child to Thika Level 5 hospital. Upon arrival, the Thika Level 5 hospital saw that it needed further referral upwards to a Level 6 facility, that is Kenyatta National Hospital. So a statement by the chairman of the Board of Management of KNH, George Oko, says that Thika Level 5 requested referral at 3:50 p.m. The patient arrived at Kenyatta National Hospital at 6:30 p.m., but the circumstances and timing of the injury remained unclear. He was received at the Accident and Emergency Department, and a team which included the consultant neurosurgeons immediately commenced treatment and investigations to determine the safest management approach. At the KNH Accident and Emergency, the patient was received in the critical care unit for immediate stabilization and surgery. So when you hear immediate, we are assuming around that 6:30, soon thereafter. Neurosurgeons have come in, other medics are there, they're looking at, so what do we do? Clinical examinations and investigations on the patient, including CT scans and a blood test, confirmed penetrating injury into the brain, brain swelling with ongoing bleeding, and possible infection. Additionally, the ability of his blood to clot was impaired, requiring correction before any surgical intervention. A process of correcting the detected anomalies by giving blood products and medication while monitoring the patient's response was immediately commenced. So everything is here is immediate. So it's within the 6:30, let's say, first 2 hours on this particular day. The patient's condition continued to deteriorate despite the interventions. However, the blood deficit and clotting became acceptable by 8 a.m. the following day, and a decision to proceed with the removal of the foreign object was made. In theater, the baby died. So we're talking about 6:30 up to 8 a.m. KNH is saying a lot was going on by this time. When did this start appearing on social media, and what were people saying? Those that took a photo of the mother holding the baby were seeing the baby at the accident and emergency, not in intensive care. Those that are saying that they have been here for many hours were seeing them at the accident and emergency, not in intensive care. Yeah. So what was it that was happening then? Should it have been happening the way it was happening?
Right, because they didn't, and this is the thing, because they didn't say she told us she was sitting there. They said we saw her sitting there.
So again, as I said, it's a very good thing. You need to normally in medicine we do audits and say, would we have done anything different here, or would we have done the same? Because sometimes we are the same thing. Now, of note, now from the statement of KNH, and it's a very informative statement. Back to the levels of care. So level 6, as you can see, part of the demonstration is that you will actually find a neurosurgeon in casualty. You get, or even a neurosurgical registrar, which is because it's a teaching hospital. And therefore we go back to Thika Level 5. You will not find neurosurgeon, for instance. You'll find maybe the medical officer who will then refer. So now thinking in future, as we are putting it, we want to transition all hospitals. You really want to upgrade them towards level 6, you get, in terms of that. So that's a good thing, because KNH would be like the only place you'd sort of get a neurosurgeon.
You come and find all this.
So already, you see the time the transition, from 2, blood products. There is now, it's becoming more efficient in terms of blood and blood products. There is a body that you remember the problem with blood. And this particular one is not even blood, it's not whole blood. You need to have blood that has clotting factors. So that is fresh blood. It's some form of technology of fresh frozen blood. So that already even is access to that. Then when you have to transfuse someone, you don't do it pap. You get in terms of reaction. So even if we say maybe the baby needed 2 pints, 3 pints, you're calculating, actually you'd say 8 hours. You get what I mean?
Right.
Get 8 hours. So even just grouping and cross match, get that blood. So you see, now we are bringing in some issues that could lead to, and you cannot, before you give that fresh frozen plasma, clotting and all, you cannot put the patient in theater because you will have killed the baby, and it. You can't take a baby to theater for show. You can't take a baby just because people want to see you taking to theater. And this is the quality approach which we need to adopt. And this is what we were saying sometimes. When the public sector goes on strike, then the mortality may decrease. You may assume that it goes up, but it may decrease. Why? If there is a deficiency in that public sector, or for instance, a drug that is not there, you'll come, we diagnose you, you have malaria. You are in hospital. Your measure is that you are in hospital. But if the drug to treat that is not there, brought a deficiency brought by someone else, then that quality of care can only be assessed when you do some form of audit. So for instance, if these services are withdrawn in a labor industrial action, then this particular person will actually go to a facility where this medication is available, and they will sort of leave. So that is an important aspect. People need to know that, even going to theater. And something called sepsis, infection. Sepsis is a very dangerous thing, and it needs to be handled pre-operatively very well.
It's all well and good, Daktari, and I think when people go to hospital, you entrust yourself to the medical professional and the professionals in the facility. But at the same time, I think you cannot discount the importance and the place of communication.
Yes.
And the place of handling. So when they arrive here, as the neurosurgeon and the others are looking at what we need to do to address this, is there somebody who is looking at the mother? Because the mother is also in a state. And the people who have accompanied them. Do they understand that we need to take care of this child? Just give us some time. Let's see what we are doing. Or when a mother is sitting there and is just with the baby and she's carrying the scans from Thika and she's waiting, and you're told, first of all, go and pay 1,200. Is there that feeling of explaining, look, let's take the baby as we deal with you dealing with 1,200 or whatever amount of money you need to pay, but we're already dealing with the patient. As you're waiting overnight, do you feel a sense of confidence that there's somebody who is taking care of my patient? Is there sufficient explanation that needs to be happening at some level?
Yeah.
With this is what we're doing, this, don't worry, we're handling it.
Yeah.
And the patient is in the best hands possible.
Okay. That did not happen, it doesn't mean it didn't happen. You see, we are talking from a point of view of the assumption that said,
we are speaking from a different village.
But that said, that is the system that is supposed to be interrogated in a health facility that you go to. Yeah, one of the challenges that you face when being attended to in, for instance, a public facility is one, the numbers, the sheer numbers of casualties, and the sheer numbers of casualties who are having similar or even worse conditions.
That's true.
I think you recall some, a journalist, I can't remember who it was.
Professor
staying in. So you're having many people with similar conditions. Two, you may be having a shortage of staff. So now, so you have the medics attending that you have. So who is this who has been employed specifically in a public institution to do what you're saying, to come, identify? So it might be the same triage nurse who is supposed to be resuscitating that particular person. So you need to address that. Is there someone specifically designed for that triage? And 3, infrastructure. Is there, even as you're saying, let's move this patient to another place? Are all the places in casualty full? You get at the time of COVID, for instance, ICU was so full that they created ICU in casualty, meaning that you come even before you go to ICU, and even that casualty one was full. So that situation now, this client who comes and is unfortunate enough to be the 14th person of a 13-bed ICU, their perception will not be the same as the one who is actually receiving service. Okay, so we need to address some of these issues, and some of these items are things that you need to address. But that said, your quality of service needs to be measured by those exact things that you are saying. When I was there, did someone explain to me? And even when you're doing an audit, the same people should be addressing and putting it out there, because eventually we want to ask KNH, yes, or any other institution, especially the public ones, that you are saying maybe we have shortage of staff. Which document can we refer to say that you had assessed and said, from what we are seeing, the number of staff we have are little? And there are documents out there, and you will hear a lot of people asking, now, why is the governor forming a task force? Yet he can just unearth all the documents already done. For instance, a lot of work was done, for instance, at Pumwani. You get addressing some of those shortages. Why don't you just extract that document and implement it? But occasionally, the task force do bring out 1 or 2 things by that. So going by that, I think the lesson from this particular child is we need to strengthen our health systems at all levels. And the various building blocks of the health system range from the community, which, again, is a conversation we like not discussing, whereby we devolved primary preventive health care and put it at national level, the curative level. And if that was actually taken the way it was, then we would be having very strong preventive, including that assessing houses for safety, avoiding those those people who used to come and check, have you been immunized, vaccinated? They can even come and say, this area is dangerous. You get what I mean? That prevention is actually underrated in terms of we always go and look at the curative level, and which of course now, when looking at it from a government point of view, it's a source of income. And again, as you can see, that particular hospital, when you go there, you're asked for what out of pocket. You see, means so. Starting at the community level, yes, awareness on preventive measures, that is safety protocols and all, prevent disease, and then also the first responder protocols should be trained. And this I agree with you. I mean, it's a conversation that everybody keeps having. I mean, what do you do when someone falls down on the street? If one of us fell down here in the studio right now as we speak, well, you're a doctor, you would know what to do. Probably, I'm saying probably. Actually, I would need to come and assess your occupational health policy, and if I come here last, so everybody just knowing what to do in places, all right, and even a policy by the institution that. Everyone knows that if this happens, for instance, even if she knows how to resuscitate, how will the ambulance come? Is there someone pressing a button somewhere? Yeah, those ones in place. Yeah. And then at the facilities themselves, what needs to be done in this particular case? So, baby has gone to the first facility. It's a private facility in the local town. Of course, there's no ambulance service in, what's that village called?
Ndula.
In Ndula. There's no ambulance. Ndula is in which county?
Thika. It's in
Kiambu County. It's in Kiambu County. Okay. All right. So those things. So an emergency. So
do you call for an ambulance? Do you get an ambulance? He is a medic who knew, I'm not going to get an ambulance. Put them in a car.
Yeah, he's on the ground.
Let me offer you the solace of knowing that you have not been abandoned.
But as we are addressing that point, you remember Dr. Alfred Mutua actually had functional ambulances which could come to your place in 7 minutes.
Yep.
You get. We haven't talked about, the hospital and treatment and stuff. We are actually saying that in earlier days of Machakos County, if you died, they actually established 7 minutes, and they gave that as their service charter. So can you learn from that across,
and you escalate it.
All escalate.
What could have changed if, for example, there was an ambulance at Ndula that's transferred this boy from Ndula to Thika level 5?
You reach hospital earlier. Now, the evolution of sepsis is that the longer you wait, the more infection, the worse the infection it is. So anyone who is injured, if for instance you get injured and you clean with spirit and all, you are more likely to survive than the guy who has mud going on, is still going on, the more bacteria, blah, blah, blah. The sepsis is worse. So there is a time.
So an ambulance and presence of paramedics.
Who know what to do.
Presence of paramedics could have helped.
Yes.
Arrival at Thika level 5.
Institution definitive management quickly would have helped again. You see now again that write a referral note, put in an ambulance, take to KNH, go and assess again. You get what I mean? Right. So if we use time as a factor of survival, then you are saying that you really need to strengthen the lowest level to do the highest level of care. You get? So even as a society, as you are growing, you should be devolving quality healthcare. Our mindset should not be referring. You should at the lowest level, you should get the highest possible quality of care. And over the years, health centers have actually been upgraded to hospitals. I'll give you an example. One of the places that I operate in is called Kigondu Sub-County Hospital. The signboard outside is Kegumo Health Center. You get it right? Because for years,
it was always a health center.
So what made it a level 3 facility, level 4 facility? One, they built a theater. You see, and therefore with the theater, then mothers who are coming to deliver can deliver there, and those who complicate can be operated there. What was it before? It was they come assess you. If you look like you are a mother who cannot, you might give us problems. We refer you to the higher level, which is Maragua, Muranga. You get what I mean?
How many kilometers away?
Like 11 kilometers away. You get. So now when they upgraded it, then you just look at the service delivery from we do like 100 deliveries a month from 0. You get, or 2, which they are saying these are, you get the point. So as a society grows, you need to devolve. And I'm the first gynecologist in that place. You get what I mean? Because Muranga County had a strategic plan of training and deploying. So what do you go there? You go there and bring administrative expertise, leadership and governance, which is the first building block of the health system. You get? And now, as we speak, there is a fully fledged hospital, because it was only maternity that was able to being built, and it will be finished in April. So that community now will not have to go to Maragua and Muranga. And they are very happy to be near home and where they can get assisted. So that is the vision for healthcare, for quality healthcare. Now, the other vision that we need to address is the economy part. That it keeps ringing, that mother that she was asked for money. I mean, we are also, in quote, victims of being asked for out of pocket. You have paid your NHIF. Then you go, you're told, this one has covered only consultancy. Now, you need an operation? No. You go do a harambe. You say, what is that? You get, so we should enter with a card. You come, you have your appendix removed, or that particular, and something that has been pre-thought of
is
paid
taken
off.
care of. Can I ask a quick question?
Yes.
If the things that you're prescribing, if they were working in tandem and this machine was working as it ought to be, would Travis have been saved? and let's look at the chain of events from doula to the dispensary where they went after the accident. From the dispensary, then to the owner of the pharmacy who now took them to Thika level 5. Then from Thika level 5 to KNH. Just looking at how things happened. If at Thika level 5 he had been attended to, or if there was a quicker mode of transport, would he have been saved?
So you wanted a perfect health system so that you're not looking for...
Not even perfect, Dr. Just something that
as in a more advanced system, so that you're not looking at something to blame for the death of that child. I'm just using the reverse and saying, if that child died at the first place where they were operated on, but they had been taken to theatre, transfused that, then I said this injury was so severe that no matter what, we would not have saved that child.
The best efforts.
Yes, the best efforts at the best, quickest possible time was employed. Yeah. So if that was done and the baby died, then you say, then the impact of this disease, the impact of the condition of the injury, the blow, was such that they were going to die anyway, you see. But now we cannot say that because the child lived for very long. Did you see? I mean, the child didn't die immediately, was hit. You get what I mean?
Yeah.
And this is...
So we should have improved the chances of survival by making sure that things are happening at lower levels.
At the lowest possible level, you should get the highest possible quality of care. And that should be your aim. So that when we as doctors are asking for doctors to be employed, then you know the reason. We are looking for highest quality of care.
Martin Jogona is asking, how many more of these cases do we have to hear about before we start hearing what doctors have been telling us for so long? The system is broken, but doctors are expected to perform miracles.
So what of importance is delinking the doctor, who is always blamed, from the system. And that was one of the conclusions. Please tell those people, it's not the doctor. The doctors actually, so at each point, that boy was seen by 10 doctors. You get at various levels, starting from the first child, you see. But now, I mean, Then secondly, we also, we needed to address the media. Please stop doctor bashing. We are seeing a trend of articles directed at doctors which are false. And please stop, ask us, call us, and we will discuss issues like that. And then
Thank you, Mr. President.
The mental health of health practitioners also needs to be looked at.
Asante, it's enough. Dr. Simon Kigondu is the president of the Kenya Medical Association. He's been here with us.